Tests and diagnosis. Your doctor may suspect adenomyosis based on signs and symptoms. A pelvic exam that reveals an enlarged, tender uterus. Ultrasound imaging of the uterus. Magnetic resonance imaging (MRI) of the uterus. In some instances, your doctor may collect a sample of uterine tissue for testing endometrial biopsy to verify that your abnormal uterine bleeding isn't associated with any other serious condition. But an endometrial biopsy won't help your doctor confirm a diagnosis of adenomyosis. The only way to be certain of adenomyosis is to examine the uterus after surgery to remove it, hysterectomy. Other uterine diseases can cause signs and symptoms similar to adenomyosis, making adenomyosis difficult to diagnose. Such conditions include fibroid tumors, leiomyomas, uterine cells growing outside the uterus, endometriosis, and growths in the uterine lining, endometrial polyps. Your doctor may conclude that you have adenomyosis only after determining there are no other possible causes for your signs and symptoms. Treatments and drugs. Adenomyosis usually goes away after menopause, so treatment may depend on how close you are to that stage of life. Treatment options for adenomyosis include anti-inflammatory drugs. If you're nearing menopause, your doctor may have you try anti-inflammatory medications, such as ibuprofen, Advil, Motrin, others, to control the pain. By starting an anti-inflammatory medicine 2 to 3 days before your period begins and continuing to take it during your period, you can reduce menstrual blood flow and help relieve pain. Hormone medications. Combined estrogen-progestin birth control pills or hormone-containing patches or vaginal rings may lessen heavy bleeding and pain associated with adenomyosis. Progestin-only contraception, such as an intrauterine device or continuous-use birth control pills, often lead to amenorrhea, the absence of your menstrual periods, which may provide symptom relief. Hysterectomy. If your pain is severe and menopause is years away, your doctor may suggest surgery to remove your uterus, hysterectomy. Removing your ovaries isn't necessary to control adenomyosis. Lifestyle and home remedies. To ease pelvic pain and cramping related to adenomyosis. Soak in a warm bath. Use a heating pad on your abdomen. Take an over-the-counter anti-inflammatory medication, such as ibuprofen, Advil, Motrin, others.